सारे नहीं आएंगे ना, जाओ बैठो। Good afternoon, everyone. Today we all have gathered here for Mission Niramaya. As you all know that we are a mental institute now, right? So, what is Mission Niramaya? Can anyone explain, or do you have any idea about Mission Niramaya? क्या है मिशन निरामया? क्यों यूपी में ये मिशन चलाया गया है?
To attain a standard in education in terms of curriculum and to maintain standards in the nursing education.
ओके, ठीक है। और मिस अनन्या, आप कुछ कहना चाहते हो मिशन निरामया के बारे में?
To have a qualified or you can say to qualified or to apply theory knowledge on the clinical in a good manner.
Okay. So let me give you a brief introduction about Mission Niramaya. हमारे माननीय मुख्यमंत्री जी ने मिशन निरामया इसलिए स्टार्ट किया है ताकि एक नर्सिंग को स्टैंडर्ड मिल सके, नर्सेस हम ऐसे प्रोड्यूस कर सके जो कि क्वालिटी ऑफ केयर प्रोवाइड कर सके। इंडिया में तो है ही है, बट वो साथ साथ में हमारा नाम, इंडिया का नाम, as we are outsourcing that particular nursing profession, we can say, right? हम आउटसोर्स करते हैं नर्स, तो जब क्वालिटी ऑफ नर्स जब हम यहाँ पे प्रोड्यूस करेंगे तो कहीं ना कहीं बाहर भी हमारा नाम होगा, राइट? सो टू कीप इन दैट माइंड हमारे यूपी में ये मिशन निरामया शुरू किया गया है, जिससे कि हम क्वालिटी ऑफ केयर, एक स्टैंडर्ड जो है नर्सिंग का या फिर नर्सिस का, वो इम्प्रूव कर सके। ठीक है, आज हम यहाँ पे सारे एकत्र हुए हैं बिकॉज आज हम सीखेंगे टीचिंग और लर्निंग की स्ट्रेटेजीज क्या क्या हो सकती है, उसमें कौन सी कॉम्पिटेंसीज ऐड करके हम स्टूडेंट्स को और स्किलफुल बना सकते हैं। तो आज का जो हमारा डिस्कशन पार्ट रहेगा वो रहेगा टीचिंग और लर्निंग एक्टिविटी के ऊपर। ठीक है, सो आगे फॉलोड बाय मिस आशा आपको बताएंगे टीचिंग और लर्निंग की स्ट्रेटजीज क्या क्या हो सकती है एंड कॉम्पिटेंसीज क्या क्या हो सकती है। थैंक यू।
Good afternoon, one and all presenting here. So this is our today's schedule. So today we are going to cover all these points. Introduction already has been shared by now I am going to give you one activity. I will give you sticky notes. On these sticky notes you have to write what are the expectations you are having from this TOT, or you can say that today's training. So you have to write down the expectations. One or two expectations. You can come and you can paste your sticky notes on this board. Within 2 minutes, you have to write down the explanations. Yeah, and one of you come and collect all the sticky notes and paste it. So, have you had completed with this activity? Yes, with this TOT, we will learn all the teaching strategies, all the assessment skills, whatever the assessment skills we are having, so that we can apply on our students, or we can see the mentees. So to be more skillful in if you are telling an aspect of your academy, you will be skillful to assess the knowledge of a student. But in if you are asking in the aspect of clinicals, that will be telling by the others teacher in the day 3 session or today. Okay. So in this parking lot, everyone has written that you want to enrich your knowledge, you want to enrich your skills in the aspect of clinicals or as well as the academic. So today in this session, we are going to discuss what all competencies you can find out in your student, so that on the basis of their competencies, you will be able to apply some teaching methodology, and you will be able to form objectives for that particular curriculum. So here I am going to distribute uh, curriculum of different courses. Now you are in 3 groups. So we are having MSc, BSc, and GNM curriculum. So on the basis of that curriculum, you have to find out the competencies. Like you have to make the objectives. On the basis of that objectives, like what all things you want when your students completing the course. Like after completion of the course, all these competencies should be there in your students. Distributed the syllabus. In this syllabus, you can select one subject. You can make objectives. You can assess the competencies, and with all these things, you have to write down the teaching methodology on the basis of knowledge, skills, and attitude. Okay. Just now we have shared one self-assessment paper. First, you have to do that self-assessment. In this self-assessment, we have written 3 things: competency, proficiency, and need support. Just read out these points. You have to mark in response one column. Anyone can tell me what is the meaning of competent like proficiency? कितना proficient है, कितना competent है किसी चीज में? कोई मुझे बताएगा कि इन तीनों वर्ड का मतलब क्या है?
Competent means like which or the person or the student or anyone who is performing can be score at least 80% of the marks. If we say 100%, then it is a proficient. Below that, we have like three more categories as well. Confident. Yes, they are.
Yes, you are right.
New beginners are there. Then two more are there.
Yes, you are right. Competent मतलब with the help of checklist or with the help of some steps, students can gain 80% of marks. Like 80% अगर वो mark gain कर रहा है तो वो competent है. Proficient मतलब skilled है. कुछ ऐसे point है जो वो perform कर रहा है और वो होना भी चाहिए उस procedure में. Like skillful है, वो subconscious mind से भी वो procedure को completely perform कर सकता है. This is proficient. Need support, you know the meaning of need support. Like each and every skill step, they need support. Is it clear to all what is the meaning of coefficient and top? Clear?
It is for us.
Yes, this is for us. You are doing self-assessment. You have to write down in response one.
We have to write down.
Yes, you are writing yourself. This is the self-assessment. You have to write C, P, or M.
In response one, we have to.
No, C, P, or response one column. You have to write
All these we have to
C, P. M. I'm giving you A4 size sheets to make. You have selected one subject. Of course. I will give you A4 sheet. So on that sheet, you have to write. First, you have to select the subject. After that, you have to write down the competency objectives on the basis of knowledge, skill, and attitude. Like all these three things, what teaching method we will apply on your student. You have to write down. And for this, you are having 15 minutes.
We have to take one subject. Can you please repeat the instruction what you are doing?
Yes. I have given you syllabus. From that syllabus, you have to select one subject.
One group will be one.
One group, one subject. उस एक सब्जेक्ट के ऊपर आपको क्या करना है कॉम्पिटेंसीज को फाइंड आउट करना है और ऑन द बेसिस ऑफ
See, competency we can assess with the help of three components: knowledge, skills, and attitude. So, using these three components, you can select competencies according to your unit, according to the subject, right? So, in knowledge, how you are going to assess the knowledge? If you want to ask something, how you are going to ask the knowledge from the students or from the people? कैसे पूछोगे आप? क्वेश्चन कैसे पूछोगे किसी को अगर पूछने हैं तो? Means of what? Related. Knowledge किसी का कैसे assess करेंगे?
Related to the topic, we can ask the question.
We can ask questions, okay? By asking questions, then
We can ask students to demonstrate.
okay, fine. So through questions we can ask the knowledge, right? How you are going to assess the skills? Demonstrations, okay. Then okay, re-demonstration, then presentation, okay.
Clinical observation.
Okay, observation, then
Presentations can be done in knowledge also, if I'm not wrong. Presentation we can assess the knowledge also.
yeah, but in general अगर हमें कुछ पूछना है तो हम पूछते हैं. It's a question, right? So question पूछ के हम किसी का भी knowledge assess कर सकते हैं. अगर कोई लेमैन भी है तो उनको भी समझ में आएगा हम क्या पूछ रहे हैं. अगर हम एक लोकल लैंग्वेज में बात करें तो, राइट? जब स्किल्स की बात आती है तो स्किल्स में भी है मैनी एरियाज जिसका हम स्किल्स असेस कर सकते हैं, राइट? तो डेमोन्स्ट्रेशन हो गया, रीडेमोन्स्ट्रेशन हो गया, प्रेजेंटेशन हो गया, ऑब्जर्वेशन हो गया, और that's it. Sure? Okay, ठीक है. अब किसी का एटीट्यूड चेक करना है, so how you are going to check the attitude?
Observation.
Okay.
Skills.
Skills. Okay. Then then ठीक है, fine. First you prepare based on the knowledge, skill and attitude, then we will be discussing how we can actually use these three components to make a competencies. Right? So you have 10 minutes to prepare whatever units you have selected from that.
From one subject we have to select one unit.
Yes, and from that particular unit ऐसे कौन से प्रोसीजर है, कौन सी ऐसी चीज है जिसमें आपको कॉम्पिटेंसी चेक करने की जरूरत पड़ेगी, और वो कॉम्पिटेंसी आप कैसे चेक करोगे?
एक unit होगा ना? Only one unit we have to take from that particular subject.
particular unit है, but you have to write the objective. Objective
क्या करना है? आपको सिलेबस
that will be
सिलेबस मिला है. सिलेबस का आप एक सब्जेक्ट लोगे और उस सब्जेक्ट में से आपको एक यूनिट सेलेक्ट करोगे, ठीक है? यूनिट में से आप ऑब्जेक्टिव्स बनाओगे, ठीक है? तो यूनिट में से आप क्या करोगे? ऑब्जेक्टिव्स बनाओगे, फिर कॉम्पिटेंसीज सेलेक्ट करोगे उस ऑब्जेक्टिव्स के लिए उस पर्टिकुलर कॉम्पिटेंसीज किसकी बेसिस पे करोगे? इन थ्री कंपोनेंट के बेसिस पे.
the unit.
Achieve that objective, what methods we can use?
Teaching methods what we can use to achieve that objectives.
So you have to select the unit in such that you can show the demonstration also. तो दोनों साथ में knowledge भी होगा, skill भी होगा, इसमें साथ में attitude आ जाएगा.
किसी को कोई कंफ्यूजन तो नहीं है कि समझ में आ गया है ना क्या करना है?
Knowledge and discussion.
observation and
हाँ नहीं दे पाए थोड़ा सा डाल दो Done. Done. All of you done? 10 minutes is over.
Yes, done.
Done? Okay. आप आ जाओ. एक present है. So from each group we are having one presenter. Explain what we are having. Okay. Just here. जो जो लिखा है मैं इसमें क्या सोच के लिखा है that you have to explain.
Okay, so we have selected as mental health nursing. Okay, that is fifth unit in mental health nursing, especially in the BSc. Okay, this is for the BSc unit fifth, and the name of the unit is treatment modalities and therapies that we are using for the mental health patients. If we talk about the objectives that we have made is like if we talk about therapies, it includes both the things, therapies as well as the pharmacology. Then, if we explain the objective to explain the psychopharmacology to the particularly students and the application of the pharmacology to the patient. Then, the knowledge regarding the psychotherapies and the application of that psychotherapies to the patients and the clinical practice side. Then, to state the alternative systems and of the medicine. Alternative systems is other than medicine and other alternative systems are like acupuncture. These all therapies are there. Counseling sessions are there. So these are the objectives. And now, how to assess the knowledge of the patient or how we can deliver the particular subject to demonstration, like one-to-one based counseling, group counseling in a small class. We can make a small groups and we can make the particular person to have a counseling session for the groups. Then, if we talk about the role play like if we have just given the lecture, we can call the particular student to display in a small way, not in a big way. Then there's live simulation. Live simulation also include like by we're teaching, then we can involve the student also in our teaching. The live simulation when we can get, then again a lecture method to deliver a content to the particular students. Now, when we need to assess the knowledge of the particular students, we can assess through short answer type questions or the objective based questions we can ask, or in a objective based question on based on quiz competition or a small quiz among the students. Then skill demonstration, re-demonstration, and observing in the clinical practice side. And we are asking the patient just to observe the ECG, how the patient is taking care before and after to the patient. If we say attitude of a patient towards the mental health, when the particular student or the person is delivering care to that particular patient, we can just see how the patient attitude towards that person. Because in mental health, attitude of the students or the person is very important for the patient. Okay, so this is
Thank you. Next.
Discontinue 2 minutes.
So in this group number 1, we have taken a psychiatry, a mental health nursing unit. Huh? So knowledge, किसके through आप knowledge assess करोगे? Short answer questions. Objectives. And skill.
Skill like demonstration, re-demonstration, or like practicing.
तो demonstration, re-demonstration आप किस पे दिखाओगे? क्या है?
Re-demonstration ये हम patient पे जैसे students हैं तो classroom में उसमें उसमें हमें special clinical setting की जरूरत नहीं है. But to observe in a real basis, clinical practice side पे भी हम
You can give them a scenario that this is the condition that patient is coming, what you will do, how you will counsel the patient. So
Also in mental health, we can try or we can just create a simulation. We can make one person as a patient and he can act or in certain way so that the students can understand the signs and symptoms of certain psychiatric disorders. So by that means we can show them the therapies.
और you can assess their skills ना.
Yes. So
Demonstration जब आप दे रहे हो, जैसे आपने आज demonstration दिया, तो re-demonstration किससे हो लोगे?
नहीं. It's required.
we will give them time to practice and after 1 or 2 days again we are going to take re-demonstrations.
And attitude आप कब करोगे? Like आपने knowledge assess कर लिया, आप कर रहे हो, तो उस टाइम में आप attitude check करोगे?
re-demonstration में भी देख सकते हैं और in the clinical setting also.
तो attitude कैसे आप करोगे? उसका कैसे assess करोगे बच्चे का?
Checklist with the help of a checklist.
Scenario का
You can say जब वो re-demonstration कर रहा है, patient के ऊपर practice कर रहा है, तो आप क्या करोगे? Demonstration, re-demonstration किस भी चल रहा है, but उस duration में उसी procedure के दौरान क्या करोगे आप? उसका observation करेंगे. Through observation, you can assess his or her attitude.
Okay, so by this objectives and competencies you have made according to the components of knowledge, skill, and attitude. So, what are the brainstorming ideas you have for a particular subject? Like, what are the idea came in your mind when you were preparing this? How you have brainstormed yourself for this particular thing?
like ऐसा सोच के कि अगर कोई हमें पढ़ा रहा होगा तो हमें कि कोई हमें पढ़ा रहा होगा लाइक कि वो हमारे टीचर है, हमें जब पढ़ा रहा होगा तो वो हम क्या एक्सपेक्ट करते हैं उससे कि वो हमें कैसे टीच करे. आइडिया कैसे आएगा वही तो बोल रही हूँ ना. वही
Like we can also
कोई और बताएगा?
What is brainstorming? What is brainstorming? किसे कहते हैं कि हम brainstorming करते हैं? ऐसी कौन सी चीज है जिससे ये word आया है? And हम ये क्यों use करते हैं?
expand your thinking beyond the knowledge what you it's existing on that particular person. Beyond that, what you can think and what you can do.
Yes.
That is brainstorming some new ideas.
Kind of critical thinking
we can say.
Right. तो आपने ऐसा क्या critically सोच के knowledge, skills and attitude के ऊपर ये सारी चीजें सोची है, वही हम पूछ रहे थे कि कौन से brainstorming ideas आपके अंदर आए थे while preparing this.
Like this experience and the clinical experience in your teaching as well as in your clinical areas, what we have learned, what we have observed. So with that different scenarios, what we have seen around us can put a more pressure or stress on that particular teacher to come up with a new expanded knowledge or expanded techniques to inculcate among the students in a very different way. That is basically, I think each teacher will put an effort to impart that particular topic, what we have learned to the students through their experience. That's why in our profession, along with the knowledge as well as equally the clinical aspect of clinical experience is mandatory, or we can say it is necessary.
Yes. So through brainstorming ideas, right, we can also help the students with the different teaching techniques, right? हो सकता है सारे स्टूडेंट के साथ हमारी जो टेक्निक है वो सेम ना हो. कुछ स्टूडेंट्स बहुत जल्दी ग्रास्प करते हैं, कुछ स्टूडेंट्स को टाइम लगता है, कुछ स्टूडेंट्स पुअर होते हैं, राइट? सो आप सबको याद होगा हमने कॉम्पिटेंसी शीट बनाई है, राइट? तो उसमें हमने नंबर्स लिखे हैं. जो स्टूडेंट्स बहुत अच्छे हैं या फिर अच्छे हैं उनके ऊपर हम ज्यादा स्ट्रेस नहीं देंगे, बट दोज हु आर पुअर, वो कॉम्पिटेंसी शीट से हमें पता चल जाएगा, दोज हु आर पुअर उनके लिए हो सकता है उनके समझने का तरीका सही हो बट हमारा पढ़ाने का तरीका थोड़ा डिफरेंट हो. आई एम नॉट सेइंग गलत हो, थोड़ा डिफरेंट हो, अलग हो, जिससे वो पर्टिकुलर स्टूडेंट्स ना समझ पा रहा हो. सो बेस्ड ऑन यूजिंग different competencies according to the students level, right, we need to make them understand. So वो चीज चेंज करके हम सारे स्टूडेंट्स को समझा सकते हैं, उनका नॉलेज इंप्रूव कर सकते हैं, उनका स्किल्स भी हम अच्छा कर सकते हैं, एज वेल एज उनका एटीट्यूड टुवर्ड्स द पर्टिकुलर थिंग हम चेंज कर सकते हैं. ठीक है?
Okay, next idea.
So we have taken, we got the syllabus of GNM students. We have selected GNM second year subject, that is medical surgical nursing 1. In that we have taken management of gastrointestinal system. Okay. In that we have taken objectives that a student should be having after completion, or the things that the child should complete after completing the unit 9 should be understanding of the anatomy and physiology of the gastrointestinal tract, then the various GI tract disorders that are present, then discussing tract disorders by assessing history, physical examination and diagnostic tests, then gaining knowledge regarding management of the patient with gastrointestinal system, and gaining positive attitudes towards the care of the patient. For this, we can assess the child's knowledge on drugs with the help of drug presentation, drug studies, and drug books, which can be given for each and every category of the GI tract drugs that we are having. Then for the disorder, we can do seminars, case presentation, case studies, and small group discussions that can be divided into students can be divided into small groups, and teachers can discuss small topics of disease condition. Then MCQs can be given for anatomy and physiology, because in the first year they have already completed anatomy physiology. To get to that previous knowledge, to assess their previous knowledge, we can give them MCQs which can be small according to the system. Then we can do for the patient care, we can ask the patient to provide health education to the patient according to the need of the patient. Then for the skill development, we can give the assessment of the GI tract, we can do demonstrations, we can do re-demonstrations, and we can do OSCE. Then for diagnostic assessment, we can do simulations, we can do audio-visual aids, we can use audio-visual aids which will give them a real-time view of what the organs and the diagnostic procedures will be. Then the alternative therapies such as acupuncture and pain relieving management that can be used in GI system, or aromatherapies when the patient is having some kind of vomiting sensation or something, that can give that can be given as demonstration, re-demonstration, and audio-visual view. Then the patient can give care of patients. The skill can be achieved by using of checklist, and it can be also done as OSCE. Okay. Then attitude for the management of the patient is generally done, or let's say can be done with the help of role play. For example, if a patient is suddenly having some kind of complication, that is GI complication, we can ask the patient to do role play as they will be doing in real scenario that will happen in the hospital. Then care of patient can be done with the help of rating scale and with the help of checklists. Thank you.
Group number 8.
One minute.
So
So for knowledge assessment, you are using MCQs, short answer questions, long answer questions.
So you have prepared objectives. So we use only in objectives like to explain, to elaborate, not to understand, right? So that needs to be corrected. Rest everything is well explained.
Thank you.
Thank you.
Thank you. Miss Swati, group number 3.
Good evening, everyone. So we got the syllabus of the MSc Nursing. From that syllabus, we have selected the medical surgical nursing subject, and from that subject, we have selected a unit that is unit 15, that is geriatric nursing. So we have made up objectives like at the end of the unit, like 15, but all the students will be able to explain or define or the elaborate at the end of the complete units or the completion of the unit. So first one would be the, by the end of the unit, the student will be able to identify the, to do the physical assessment of the geriatric patient. Like when they are going to the geriatric, when they meet the geriatric patient at the hospital setup or at the community setup, then they'll be able to do the physical assessment in the detail and take the history collection also from the patient. Next objective would be to identify the needs of the geriatric patient. Next is the needs that will be having of one geriatric patient would be having, that need the student will be able to identify that. Next is to define the aging process. Next is to differentiate between the myths and the realities. Next would be to identify the health related issues of the geriatric patient. And next one is to list down the stress and the coping in elderly, the mechanism that they will be using. Lastly, role of the nurse in providing a nursing care to the geriatric patient. So, like now at the end of the session or the completion of the unit, how will we be able to assess the knowledge and the skills and the attitude of the students? So, knowledge we can assess through the questionnaire type. We can ask the questions in objective questions or the subjective question we can ask, open-ended question we can ask, like the student can able to explain in a detail. We will ask the open-ended question. Next, the skill assessment. How we can assess the skill of the students. So we can assess through the demonstration and the re-demonstrations. We can also with the help of the checklist, we can also assess the skills and the simulation and the role plays. And with the help of the skill labs, we can assess the skill of the students, and at the hospital setup, we can also assess the skills, like in the real life situation. Yeah. Next is the rating scale. So next is the to assess the attitude of the student towards the geriatric patient, towards the providing a nursing care to the geriatric patient. So the attitude of the student we can assess through the rating scales, the feedback of the students, and through the standardized tools, that is like checklist. That is all. Thank you.
In skill lab, you are assessing the skill, ना? Skill lab.
Skill lab.
So skill lab में ऐसे मतलब क्या है, किसके through आप assess करोगे उनकी skills?
Like the dummies, they'll be like doing the physical assessment of the patient, like on the dummies. So we'll be able to identify like if the geriatric patient would be there, like if the dummies would be like the geriatric patient. They'll suppose then they'll go from the head to the toe.
So for that you are having a checklist, na?
Yes.
So with the help of checklist,
with the help of the checklist,
you are
like
going to
step by
assess.
step they are doing the procedure or not. They are getting.
For that you are having also a score stations.
Yes.
Thank you.
So you have selected competencies, right? And now you know that how to prepare a course plan. We are going to make our institutional course plan based on the competency, the new objectives we are going to formulate, the pedagogy will be different, and based on that we are going to evaluate the students, and those students who are weak, right, we are going to help them with the different strategy or with the different teaching learning methods.
कॉम्पिटेंसीज के बेसिस पे आपने ऑब्जेक्टिव सेलेक्ट कर लिया, आपने अपनी टीचिंग मेथोडोलॉजी से असेसमेंट भी कर लिया। अब असेसमेंट से आपने फाइंडिंग किया कि हमारे पास कितने वीक स्टूडेंट हैं और कितने हमारे पास लाइक हमारी जो टीचिंग मेथोडोलॉजी है उन्हें सूट करे, दे आर कंफर्टेबल दिस टीचिंग मेथोडोलॉजी। बट जो हमारे पास वीक स्टूडेंट हैं उनके लिए हम क्या करेंगे? जो असेसमेंट क्राइटेरिया हमने बनाया है वो एज इट इज रहेगा। So we have revised that assessment criteria. Reassessment. So on the basis of this flowchart, we have to make our institutional cost plan.
Okay, so at the last, what kind of teaching environment is needed for a good learning and good teaching as well as from a teacher side it will be a good learning process, a teaching process, and from the student side it will be a good learning process. लर्निंग एक्टिविटी के लिए क्लासरूम का एनवायरनमेंट कैसा होना चाहिए, क्या क्या होना चाहिए? A good infrastructure should be, lighting should be there, okay, proper ventilation, okay. Okay, first if we talk about the physical structure or infrastructure, आपको एक कैसा क्लासरूम अच्छा लगता है जिससे आप अच्छे से पढ़ा भी सको और आपके स्टूडेंट्स अच्छे से पढ़ भी सको? ऑब्वियसली क्योंकि जब स्पेशियस होगा तभी हम लास्ट बेंच के बच्चे तक पहुंच पाएंगे, स्टूडेंट को रीच कर पाएंगे कि वो क्या कर रहा है, ठीक है. सो क्लासरूम शुड बी स्पेशियस, देन
there should be a podium which will be visible for the students. There should be a podium or a stage where the teacher can teach and it will be visible for them, the last benchers also.
Okay, okay, fine. But in the now new pedagogy or the new invention says that there should not be any podium between you and the students, right? It should be like free communication should be there. क्योंकि जब आप behind the podium खड़े रहते हो, this work is an obstruction. So you should be roam around in the class. You should be roaming around the class. You should be focusing for each and every student. जो first में बैठता है, जो last में बैठता है, हमारा सबके ऊपर focus होना चाहिए. तो classroom should be spacious, well ventilated, well light होना चाहिए. और आपके classroom में क्या क्या?
It is well ventilated.
Okay.
Proper lighting है.
Okay.
So what audio visual aids you are having in your classroom?
Blackboards, there are projectors, portable. We can also use charts, flashcards.
And you have beautifully decorated notice board as well in the class, right? It shows your education policy, your classroom objective, clinical objectives, timetable, everything is there on your notice board. So एक अच्छा classroom, अच्छा environment देने से एक student को भी अच्छा लगता है, positive vibes आती है कि students को भी पढ़ना है और आपका भी classroom में जाके पढ़ाने का मन करता है, right? So let's summarize the topic or let's summarize today's session. What have you learned today?
We have learned all in all everything. That is how to take care of the students and how to teach them with quantity and not just with quality and not just quantity,
Okay.
and enable them and impart in them the knowledge in the best way that as a nursing college or school has to impart on the students, so that when they leave the institution or they when they go and work in the in the hospitals or in the other institutions, they're independent enough and they do not have to depend on others to show their skills or to impart the knowledge, again transfer that knowledge to the future generation.
Okay. So we have started with Mission Niramaya. Then I have explained what we are going to do today in today's session. Then you have prepared objectives based on the competencies, right? You have divided them into 3 sections. What are they? Knowledge, skills, and attitude. Okay. After that, you have assessment. Yes.
Reassessment, demonstration, which we can understand if a child is weak, so we can do reassessment. We
based on that, we have also discussed the brainstorming ideas, right? And at the last, we have also discussed the how the teaching learning environment or the classroom environment should be. So we are ending this session here. If anything, Ms.
Yes,
Asha
I
wants to
want to
include.
इन टीचिंग इन्वायरमेंट लाइक हमारे पास क्लासेस में क्या बोर्ड्स है, वो नोटिस बोर्ड के नाम से है। अगर वो नोटिस बोर्ड के नाम से हटाकर स्टूडेंट बोर्ड कर दिया, प्रेजेंटेशन बोर्ड तो है और कोई स्टूडेंट बोर्ड लाइक स्टूडेंट्स जो है वो अपने अकॉर्डिंग उसमें कुछ भी आर्ट एंड क्राफ्ट करके लाइक दे कैन मेक अ पॉजिटिव एनवायरनमेंट इन द क्लासरूम। जैसे नोटिस बोर्ड हटाकर स्टूडेंट बोर्ड कर दे तो अच्छा होगा, लाइक दे कैन फील गुड, देयर विल बी अ पॉजिटिव वाइब्स क्लासरूम। ऐसा नहीं है कि नोटिस बोर्ड लाइक नोटिस एक तरह से ऐसा लगता है कि कुछ नोटिस ऐसा है, बट अगर वो स्टूडेंट बोर्ड के नाम से हो जाएगा दे विल फील गुड। दिस इज द न्यू थिंग दैट वी कैन इम्प्लीमेंट इन आवर क्लासरूम। थैंक यू फॉर